This is me on November 5th, 2019. My husband and I had recently purchased an old farmhouse and were in the process of renovations. Things were not going according to plan, and there were a lot of issues with the house and our contractor. My stress was at an all-time high, and I was extremely depressed. As you can see here, I was beginning to form a bare spot in the front of my scalp.
So as you can see, hair loss is very emotional, and it can happen in both men and women. I myself am even dealing with a little hair loss. I know you probably think I'm nuts because I have a lot of hair, but I started noticing probably a year or two that I could see my scalp more in the front, and I'll get into that with you. And I myself was emotional. I found it disheartening. So today I want to talk to you about hair loss, what can cause it, the different types of hair loss that exist, and ways to treat it. If you're new to my channel, I'm Dr. Hannah Kopelman, and I happen to be fellowship trained in hair loss. Today, I'm going to share my insights and experiences with you. If you're new, don't forget to hit the subscribe button. Let's get started. First, it's important to set the terminology straight. So many people come up to me and say, can you help me with my alopecia? Alopecia is just a broad term that means hair loss. There are so many causes of hair loss, and today I'm just going to talk to you about the most common causes. In future videos, we'll talk about other causes. Hair loss is just such a big topic, so we have to break it down. So today I'm just really going to focus mostly on a hair loss called androgenetic alopecia. And androgenetic alopecia really means hair loss that's caused by genetics. This is a type of non-scarring hair loss, also known as non-cicatricial hair loss. I know these are very long, fancy words. So just know, AGA, short for androgenetic alopecia, is the same thing as male pattern baldness or female pattern baldness. So we'll talk about that today, and we'll also touch a little bit about telogen effluvium and alopecia areata. Okay, let's talk about the most common cause of hair loss that I see in practice. AGA, androgenetic alopecia. 85% of men by the age of 50 will experience this type of hair loss, and 50% of women by the age of 60 will experience this hair loss. So as you can see, it's very common in both men and women. And so what happens is the hair follicles on our scalp are genetically sensitive to a hormone, an androgen hormone known as DHT. So that leads to hair falling out. In men, we'll first notice this as a hairline recession. So usually you'll see hair loss first start out in the bitemporal region, and then it will slowly start to move its way back and head towards the top of the scalp, also known as the vertex or the crown. And you'll start to see that men have both hair loss in this area as well as they'll have a bald spot here. In women, if you part your hair and you see your part, what happens is you'll notice that you'll start to get something we call the Christmas tree pattern, because their hairline will actually start to widen towards the front of their scalp. So fortunately, I don't have that, but that's what we typically see in men and women when they start to have androgenetic alopecia hair loss. So if you're watching this, it's probably because you're experiencing some sort of hair loss. I do want to make sure you know that we have over 100,000 hairs on our head, and it's actually totally normal to lose about 100 to 150 hairs a day. Most people don't come to see a hair specialist, a dermatologist, until they have noticed that either they have loss of volume or they're noticing an increase in the hair in their brush or in their shower, and they're just noticing a lot more shedding. Because the normal, if I showed you my hairbrush, you'd be like, wow, that's a lot of hair, but it's accumulated over time, and I obviously should be cleaning my hairbrush more regularly. So it's very normal that as you brush your hair, you're going to shed a few hairs. In the shower, you'll see some hairs, but if you're starting to notice an increase in that volume of the hairs in your shower that are either filling up your drain or you're pulling your hair like this and you're coming out with clumps of hair, then that's something to be more concerned about. So it takes about, actually for most people, they don't approach a doctor for help until they have actually lost about 50% of their hair on their head. And I'm probably just an exception here. I started noticing it, as I said, like a year or two ago, but this is probably because this is what I do. This is what I love. I love treating people with hair. I think it's such an emotional condition, and I want to help people because no one really understands that men and women are both affected by this, and children can be too. So in my example, I have some hair loss just in the front, and I started using Rogaine, and we'll talk about that in a little bit. So the most common causes of hair loss are genetics and family history. So if you have siblings or parents that have hair loss, then you are likely to experience it as well. You can also experience hair loss from metabolic factors, environmental factors. Sometimes it's from medication or recent illness, and sometimes we don't even know the cause, unfortunately. And this can be really frustrating, but don't worry, because usually the treatment is the same course of treatment that you would use for any other type of hair loss. So if we don't know the cause, we'll get to the bottom of it and hopefully we can treat you. So now I'm going to explain to you a little bit of detail about the phases our hair goes through during our lifespan. So our hair goes through a growing phase and a resting phase. The growing state is called anagen, and 85 to 90% of the hairs on your head are in the anagen phase. 10 to 15% of your hairs on your head are in the telogen phase, which is the resting phase. The anagen phase we actually spend about 1,000 days. So anywhere from 3 years to 6 years are spent in the growing phase. So as you know, you have to go through a lot of frequent haircuts. And then about 100 days or 3 to 5 months are spent in the telogen phase, which is the resting phase. So after the telogen phase, your hair starts to fall out or shed, and this is the normal cycle of your hair. I do just want to bust one misconception, and that's that don't blame just your mother's father or your grandfather, because your hair loss can be genetically passed down from both sides, and you also might be the first person in your family or the first sibling to be experiencing hair loss. And this type of hair loss can start at any age, but it's very common around the age 20 to 30 after puberty. Very common to start seeing that you're losing your hair. A few of the medical conditions I want to point out that can cause hair loss are iron deficiency anemia from heavy periods, heavy menstruation, untreated thyroid disease, vitamin D deficiency, PCOS, lupus, a medical condition called trichotillomania where people actually pull out their hair, and medications can cause it, and sometimes you can even have a fungal infection in your hair that can cause hair to fall out. Dermatologists can also do a hair biopsy or a biopsy of a hair follicle to try to figure out what the cause is, but this is typically not necessary and it's very unusual to have to do a hair biopsy. Now let's jump into telogen effluvium, which is what we witnessed in the video I shared with you in the beginning. Telogen effluvium is when you have an excessive hair shed. It's acute, it's diffuse, so it can be all over. It's not just in one area typically. And it's when you start to lose more than 150 hairs a day. You can lose up to 400 hairs a day. I've actually had patients walk into the office with a paper bag after they experienced COVID, and it came with a full bag of hair. I also have seen patients after a car accident that was very traumatizing. So it's very common after recent illnesses, recent surgeries, time in the hospital, a recent pregnancy or childbirth. You can start to have an excessive hair shed, or recent illness, or even if you started a new medication, you might see this, or if you're deficient in iron. So there are ways to treat this or speed up the process, but you have to be patient because it can take anywhere from 6 months to a year to get your hair back to its normal volume and the amount of hair that you're typically used to. Now, the moment that everyone's been waiting for is the treatment options. So I'm going to go over the topical options you have, the oral medications you have, some other options you have. And of course, if you have a medical condition, it's important that you treat that underlying condition because that might be the cause of your hair loss. So today, let's first start off with the topical option. This is 5% minoxidil, and I use this daily. It's also known as Rogaine. You can buy it over the counter. And you're probably wondering, why am I using men's Rogaine? Well, Rogaine has done a nice marketing thing where they only sell women's 2% Rogaine, and 2% doesn't really do much for you. So always choose the 5% option. And men's comes in liquid and foam. You can use whatever you prefer. I'm using the foam. I'll show you how it goes on. If you're a woman and you're watching this, then you can still use the men's. So don't get confused by the marketing. So typically, this is how I put it on. I give it a shake because it is foam. And usually I can't really see myself because I'm on camera, but I'll part the area that I know I want to concentrate. And it's very important that you massage it into the scalp and not so much into the hair, because I think a lot of people use this and then they get frustrated and they're like, it's not working. But I think it's because they're putting it into their hair. You really want to target the hair follicles, and you need to give this at least 12 weeks, 3 months to work or to see any difference. So don't expect to use it for a week and be like, oh, my hair's not growing, I'm done with this. Give it time, be patient. Hair, I know, is frustrating, but it takes time. So just try to do your best to be patient. So give it a shake. Okay, we got the cap off. As you can see, this is like where I feel like I have the most hair loss. So I just spray it into that area. Okay. And I also have a little hair loss in my temporal area, and I just really massage it in there. And then I could put some over here. I kind of like go in the circular motion. Some of it's kind of going down my forehead, which I will wash off after. And then sometimes I take a brush and just like brush my hair through. And that's what I do. I do it 1 to 2 times a day. Usually it's kind of like brushing your teeth. So in the morning after I brush my teeth, or before, I spray it in there, and before I go to bed. The important thing to remember is after you have finished applying the Rogaine to your hair and touched it, wash your hands. Because if you start to touch your face or your chin, you'll start to possibly grow a beard, which obviously if you're a female, you're not going to want to grow. Actually, I have even noticed sometimes if the Rogaine has dripped down my forehead a little, I start to get like a little bit of peach fuzz on my forehead. So I'm going to go wash it off my forehead now so that doesn't happen. But that's pretty much how it is. It's very easy to use. And I have seen that over the course of 3 months, 3 to 4 months, that I have started to notice that an increase in the hair growth and the volume. I even see little, what we call vellus hairs, which are like peach fuzz coming in, and I know that this is working. So I want to clarify one more thing about this. A lot of people are scared to use it because they think that as soon as they stop using it, your hair is going to fall out. What happens is minoxidil, which is the ingredient in this Rogaine, it prolongs the growth phase. So it prolongs the anagen phase, which we talked about before, and it prevents the hairs from going into the resting phase, the telogen phase, and then it prevents it from falling out. So what happens is when you start to use this, you may notice some hairs start to shed. Those are the hairs that are already going to shed, but it may have accelerated the shed to happen a couple weeks sooner. But then more hairs start to go into those anagen phase and they're growing. If you abruptly stop using it over time, immediately nothing will happen. Your hair will still be in the anagen growth phase. But over time, the hairs will start to go into the telogen phase and then they'll start to shed. So it is important to be consistent. And what I tell people is if you're eager to get your hair back, use it consistently for at least 12 weeks or 3 months, or maybe even up to 6 months. And then if you're starting to feel like it's a nuisance and you don't really want to use it every day because you have just too much to do and you have too busy of a day, then I just would say use it as a maintenance. So do it twice a week. That way you don't feel like you have to do it every day. But do expect to get a little bit more of a shed when you start to use it. And if you stop altogether and go cold turkey, whatever hairs that you were preventing from falling out will fall out in a couple weeks or months. Most people tolerate minoxidil or Rogaine really well, but some people get a little bit of irritation or itchiness. It's not very common. If you start to notice that, just back off of it a little and then maybe just do it once a day or a couple times a week. But overall, I don't really hear of people complaining about any side effects. And as I said, the only other side effect you can get is hair growth in other places if you don't wash your hands. So Rogaine is a great treatment for someone with androgenetic alopecia, so either male pattern baldness, female pattern baldness, can also be used in telogen effluvium to speed up the process of the regrowth, but I don't want you to use it if you're breastfeeding or pregnant. Two other topical options that you might consider depending on your hair loss are ketoconazole 2% shampoo, which I mentioned in my dandruff video. And this is used to treat usually the fungus that causes dandruff, seborrheic dermatitis, also known as malassezia. Sometimes malassezia or this fungus can lead to hair loss. So it has been shown in some studies that using the shampoo during your routine can help with hair regrowth. Also, if your dermatologist notices that you have some inflammation that might be causing your hair loss, they might prescribe you with a topical steroid. Now, there are some great oral treatment options for hair loss. These include minoxidil, spironolactone, also finasteride or dutasteride. Now, minoxidil and spironolactone you may have heard of before. These are originally blood pressure medications. What happened was we were giving them as blood pressure medications and people were starting to actually increase their hair volume. So now we prescribe these medications at a lower dose and we get those benefits of hair regrowth without affecting our blood pressure. Sometimes when people initially start taking these medications, they may notice an increase in urination or a little bit of dizziness or lightheadedness. And if that's the case, then just make your doctor aware. But I always encourage people who just started any of these new oral medications to hydrate and take it with a full glass of water to avoid any effects on your blood pressure. Now, there's not great data to support the use of biotin or collagen supplements for hair loss. I know a lot of people, when they start to notice that their hair is shedding, they run to the pharmacy or their vitamin store and they start buying all the hair supplements. There's really not strong data to support this unless you are deficient in collagen or deficient in calories or deficient in biotin. Then yes, of course it will help, but overall it has not shown great data to support that it will stimulate hair regrowth. You can also try a red light therapy cap, also known as a low-level light therapy. This is thought to work because it increases the microcirculation around the hair follicles, which may stimulate hair regrowth. There's some data to suggest it works, but it's shown to really work best when used in combination with other medications, like the oral medications or even the topical Rogaine. All these things in combination have shown to work the best altogether. Now, if you've tried the oral medications and they're not for you because you may be experiencing some side effects, and I do also want to mention you might experience some sexual side effects like impotence or erectile dysfunction or even breast tenderness is common, then you might want to try something more cosmetic. So you have two options, microneedling, or you can also do something called PRP. So microneedling is you take a very fine needle and you're doing little micro injections with that fine needle throughout your scalp. This is causing like a micro trauma or a micro abrasion that is supposed to stimulate growth factors into the area and new collagen growth, and is supposed to stimulate hair regrowth because it's like coming in and healing the skin and causing this inflammatory process. Microneedling has been shown to work really well synergistically in combination with other medications. So if you're using topical Rogaine or topical minoxidil, then it's shown to work very well if you're doing microneedling. And I believe this is because it can penetrate deeper into the scalp beneath the first layer of your skin and start to really stimulate the hair regrowth. You also have PRP, which is called plasma-rich platelets. So the way this works is we actually draw your blood, we spin it down, we take out the platelets, and we inject it into your scalp, also causing microtrauma. But the thought is that the platelets contain growth factors, which stimulate hair regrowth and also stimulate a healing process. Both of these options are cosmetic and they can be costly and they may not work for everyone, but when people are dealing with hair loss, they can often be so frustrated and desperate that they just want to try everything possible. But as I mentioned, all of these options take time. Even the oral medications, we say take it for 3 to 4 months before you decide whether you want to stay on it or not. Because once you stay on it, it's kind of like a long-term thing that you'll stay on. You don't want to just go off of it, just like you don't want to stop your topical minoxidil. So I do just want to touch quickly upon some natural substances that are out there for hair loss. One is castor oil, rosemary oil, caffeine, also some different types of mask people use. Palmetto is another one which actually blocks DHT, which is a hormone we talked about earlier. And there is some evidence that blocking DHT can help the hair stay in the growth phase longer. But you have to be very careful with any natural substance because they're not heavily regulated by the FDA and we don't have strong evidence to support their data. I hope you found this video helpful. I really wanted to summarize for you what hair loss is, what causes it, and the treatment options that are out there for you. You're not alone. I'm experiencing hair loss too. If there's hair loss treatments that are working for you that I didn't mention today, leave them in the comments below. If you want to just reach out to me and talk to me, feel free on TikTok, Instagram. I'm here for you, and I would love to hear from you. So I'll see you in the next video, and don't forget, listen to your skin and take care of your body.